everyone. I'm Alisa Gumbs, the Executive Managing Editor of Black Enterprise, and welcome to Addressing Racial Health Disparities. When the COVID-19 pandemic first hit, it was called the Great Equalizer because it affected everyone. But we all quickly saw that it didn't affect everyone equally. Never has it been more obvious that the historic and systemic inequities in healthcare in this country can, and sadly often do, have deadly consequences. Today, we have three experts who are working day in and day out to close that health gap. Shauna Davis, Senior Program Director of the Black Women's Health Imperative, the first nonprofit organization created by Black women to help protect and advance the health and wellness of Black women and girls. We also have Duane Reynolds, the founder and CEO of Just Health Collective, which provides diversity and inclusion training to some of the country's largest healthcare systems and advises them on how to provide health equity to their patient populations. And finally, we have Dr. Reed Tuckson, a former Commissioner of Public Health for the District of Columbia and the co-founder of the Black Coalition Against COVID-19. Thank you all for being here today. Before we start the conversation, I'd love if you could each quickly share with our audience a little bit about your backgrounds and how you came to be passionate about doing this work. I'm going to start with Shauna.
Hello, my name is Shauna Davis, and I am so excited to be here to advocate for the health and wellness of women in this country and to share how each of you can be part of that. I've had over 20 years in the nonprofit sector, really focusing on advocacy work for women in particular. I'm a senior program director at the Black Women's Health Imperative, and my work focuses on three areas of ensuring that we're increasing equity in biomedical research, in the Affordable Care Act, specifically access to quality health care in support of women, as well as ensuring that our generations to come understand the impacts of tobacco and tobacco use on our community. So thank you.
Thank you. Duane?
Thank you. I am excited to be here speaking on this topic that is very near and dear to my heart and really a passion and culmination of the work that I've done in healthcare now for over 20 years. I started off my career actually in health system, running physician faculty practices, so really in the business side of healthcare. That led me to management consulting for healthcare organizations and really taking on a leadership role internally that was focused on inclusion and diversity. So I've been able to actually marry my two passions, inclusion and diversity in healthcare, and really bring focus to health equity. And prior to starting the Just Health Collective, which is my business, I led the Institute for Diversity and Health Equity, which is part of the American Hospital Association.
And Dr. Tuckson.
Thank you. As you introduced me earlier, I am a former Commissioner of Public Health for the District of Columbia. And during that time, it was the height of the AIDS epidemic. The one thing I learned most clearly and indelibly is that to fight a major health challenges such as the pandemic now or HIV/AIDS then, is it requires a robust community-based infrastructure, a grassroots movement that partners with government. And secondly, I was lucky enough to be the president of the Charles R. Drew University of Medicine and Science, one of the 4 historically Black medical centers in this country. And by being a part of that, I also understand the vital importance of our healthcare academic and medical society leadership as we speak to the Black community with trusted, fact-based information that comes from a source of empathy and love and caring for all of our people. Those are the reasons why we've created this Black Coalition Against COVID.
I'm going to open the first question up to any or all of you as we lay the groundwork. When we talk about inequities or inequalities in the healthcare system, what exactly are we talking about?
Well, I think I'll start then if and see how our colleagues will support this. The fundamental issues for inequality are complex and multidimensional, and that's one of the challenges that we face. The good news is that because they are multidimensional, it gives everyone who cares about Black life and Black survival an opportunity to participate. We understand first and foremost, there are the structural issues, structural racism issues that affect where we live and how we live, our housing. It affects whether or not we have healthy neighborhoods or unhealthy neighborhoods filled with stress, violence, and tension. It determines whether or not we have access to healthy foods or whether we live in food deserts and making the right choice a difficult choice when it comes to our nutrition. We also have the challenges that are baked in with difficult access often to quality healthcare and healthcare that meets our personal and individual needs. And then we have the challenges of how we ourselves make choices about our own behavior in our lives. Sometimes we are not our best friend and sometimes we are our worst enemy. And one of the things we have to continue to do is focus on the choices and decisions that we as individuals make. Those are some of the factors, but I know my colleagues will have others to share.
Sure, and I'll add on to what Dr. Tuckson elaborated. Really, I think of this in 4 buckets: political, environmental, social, determinants of health, and finally, the healthcare and public health system collectively. So there are foundational things that impact our community that have stemmed from systemic racism for many years and have put us behind the ball in terms of caring for our community in a holistic way that is focused on changing many of the conditions which ultimately impact our health. And so in that knowledge of the system and the things that are necessary to change, it's really about bringing folks together across sectors to really be able to make impact ultimately.
And the one piece that I would add is that in our work at the Black Women's Health Imperative, we are focusing so much on health literacy right now. I think that we have seen, particularly with regard to this pandemic, that that health literacy really drives some of the misnomers and continued gaps that continue to grow. And keeping the conversations front and present will allow for us to work to close these gaps.
Duane, you mentioned historic, and I'd like to take a minute just for us to go back and look at how we got here to this health gap that we have. What are some of the historic factors that have gone into creating it?
So when we think about things like redlining, things like not having investments in the Black community, housing discrimination, all of these factors have ultimately led to the social determinants of health that exist in different zip codes within different cities. Those social determinants of health ultimately have the most impact, even above medical care, for individuals who are living in those specific zip codes. And what we see is that the place that you live ultimately matters. You could live in one zip code and a matter of blocks away in a different zip code, they will have better disparities and longer life expectancy.
Anyone else want to weigh in on how we got here?
Well, I think one of the key issues that we are, in addition to the important issues around our access to wealth, our access to housing that makes sense, our access to food, all of these are so important. And as the audience will continue to hear, these are important drumbeats that we are sounding. We're saying to the audience, to each and every one of you, that if we are going to be able to understand why we have the disparities in health status that we do, we have to keep coming back to this being multifactorial. And it really does mean that we as a people have a fundamental decision to make. Do we care enough about Black survival to address the full range of issues and challenges before us? And that means that each of us has a job to play. The one critical thing I think that gets us where we are that is important for today's conversation is the issue of distrust. We do not trust the healthcare system because of longstanding historical insults, such as the Tuskegee syphilis study, the Henrietta Lacks experience, and many, many others. When it comes to our community having to take to the streets and declare with a primal scream, my life matters, my dignity matters, who I am as a person matters. That is not just a scream about the criminal justice system or the police department. It is not a scream about the political system. It is also a scream that reverberates into how we make choices about our health. And so what I will come back to is that we have to create an environment where ultimately we as a people can overcome the longstanding and legitimate distrust, but make better choices and decisions that reflect where we are in this particular historical moment. And that's the real challenge facing so many of us. Can we understand and make our peace with the past and be able to move forward and make intelligent, personally appropriate choices for ourselves, our families, and our communities in this particular moment?
I want to talk about some of the real life consequences of these disparities. And Dr. Tucson, I'm going to start with you because, of course, COVID-19 and the impact that it has had on Black and Brown communities cannot be overstated. It's everyone's current, real life illustration of what happens when healthcare and access to health are unequal. So can you talk to us about what's been going on with the pandemic?
Well, the thing I mentioned back to, if you think about HIV/AIDS and that experience, the number one rate limiting factor and struggle we had to get the community to do things to necessarily to protect ourselves and not spread that terrible disease was to overcome the history of the Tuskegee syphilis study. It is amazing that 40 years later, the number one thing that we have to overcome if we're going to get people to be able to respond appropriately is still the Tuskegee syphilis study. It is amazing to me and so painful to realize that this issue of distrust is so powerful. Distrust is not an idle emotion. It leads to premature death, misery, and suffering. And so what I would sort of remind us now as we go forward is we have to learn to think about what the insults of the past were and then be able to deal with them in the modern world. Specifically, the reason that Tuskegee was such a terrible, horrible insult to the civilization of this nation was that people with a disease were denied access to the treatment that would have saved us. Many, many people that we talk to around the country now about this pandemic, we talk about using a vaccine that is safe and proven to be effective, is that we won't take it because of the Tuskegee study. So we almost use the past as a way of denying ourselves the very thing that we were upset about in the moment. It's a paradox that we have to start to understand, and we as a people have got to start to come to terms with how we make choices as we overcome the absolutely anger and frustration of the things that have happened in the past.
Personal choice is clearly a big part of this. Are you seeing some other things as we talk about the vaccine in terms of our access to the vaccine and any inequalities that are happening there?
Well, as we look across the country, we are seeing that vaccine administration, there are disparities in that, disparities in the uptake amongst the Black community. And so part of that is related to mistrust, but part of it is also related to the healthcare system failing us in terms of access points, in terms of getting into the community and really encouraging and educating folks and allowing us to make our own decisions, but giving us the right type of information in order to be able to do so.
Shana, I'd like you to talk to us about women's health specifically and some of the disparities that we're seeing there.
So, across the board, we are looking at just so many areas when it comes to women. So, obviously the Affordable Care Act and preserving and expanding the Affordable Care Act impacts women's health. But we're also looking at Medicare and Medicaid access to affordable medicines. We're looking at improvements in menstrual equity. We're looking also at increased opportunities to remove copays related to screenings such as mammography and looking to include 3D mammographies as a standard choice for women. In addition, access to safe and legal abortions. I mean, I think all of these areas, we see that that equity is part of that, and health literacy is very much a part of that. When we have these discussions, we often focus primarily on race as the number one determinant attribute. But as the other panelists have said, geography, income, education, age, sex and gender, or sex and sexual orientation and gender. We see opportunities to increase sex education conversations in high schools and elementary schools, because this is where we can really start to turn the tide, particularly as equity relates to women and women's issues.
One of the things that I think is just starting to get some exposure, some much needed exposure, is around Black women's reproductive health and maternal health. When Serena Williams was vocal about sharing her labor and delivery practices, a lot of people for the first time clued into the fact that there's a Black maternal health crisis in this country. Is that part of what you guys have been focused on?
Absolutely. At the Black Women's Health Imperative, access to quality health insurance and programs that protect women's health throughout their lifetime and that foster not only their maternal health and a healthy pregnancy, but postpartum health as well for mothers and for their babies. We also recommend that from a policy perspective, that we really push for policies that support reproductive health overall. And as the former panelist said, looking at the social determinants of health, not only just access, but access to good housing, good education, jobs, and anything that really fosters a whole, full, and supportive life for girls, mothers, and their children.
Alisa, I would also add, as a Black man and as a Black health professional, I am particularly disturbed and upset by the increasing numbers that we're seeing of domestic violence. The quarantine associated with this pandemic has certainly been unhelpful, to say the least, on those statistics. The more that we are spending now time indoors, the more that people are frustrated, the more people are losing their jobs. All of those elements building up to people drinking more and substance abuse more. The victims of that too often are our women. And I would have to express in the strongest possible terms that every man listening to this panel needs to redouble their efforts in their fidelity and their protective role for Black women, particularly at a time like this when there is so much stress. We simply cannot tolerate it. And for those of you who have the resources, I would urge you to support with your dollars the shelters for abused women. This is the time, because those shelters are overrun. Those private homes that we don't even know where they are, usually because they have to be hidden away from the perpetrators. But those people need support, and I would hope that every one of us with conscience would dig into our pockets and support that.
Dr. Tuckson, thank you so much for bringing social emotional wellness to the forefront of this discussion as well. I think we can all comfortably say social emotional health and wellness is not something that is germane to us from a cultural perspective, and that this pandemic has very much put us in a place where it's at the forefront of conversation. And when we're looking at equity and access, we also want access and equity for Black women, for their families, to ensure that our families are whole and well. And we know that by expanding the Affordable Care Act, we will have better opportunities to ensure that everyone has access to the health and social emotional wellness support that they need.
Yes, that is absolutely such an important point. Shana, there's one other area where I know you've been particularly vocal, and that's around medical research and the lack of inclusion, which is something that most of us in the general public aren't even aware of. So can you tell us about that?
Absolutely. one of the roles that I have at the Black Women's Health Imperative is working to elevate, educate, and advocate for diversity in biomedical research. So for the layperson, we might think that it's very much about the stories that we've heard about in the past, the Henrietta Lacks story, the Tuskegee story. But the reality is the All of Us research program is focused on building a database of 1 million plus individuals, participants who choose to be part of this program. And so, going back to my point earlier, diversity in the program isn't just about ethnic or racial diversity. It's about diversity in age, geography, income, education, health status, healthcare access. And by participating, researchers will have an opportunity to use data to learn how our specific biology, lifestyle, and environment affect health. I am a participant in the program, and I chose to participate because, like many of us, there are chronic illnesses in my family. And I wanted to understand as a mother how my decisions and how that information can help me improve health outcomes for not only my daughter, but for future generations. And, we know that trust is absolutely a factor. We also know that building trust comes with education. And so the All of Us research program is very much committed to building trust in our community and to help educate us about the importance of being involved in research, because if we are not part of it, then we are not part of the solution.
Oh, that's so great. And by the way, can I just sneak in real quick on this? This is such a major point. And the good thing about speaking to a BE audience is that these are people who are problem solvers, people who are not afraid to take on challenging issues. We cannot, as a people, continue to be upset and pissed off about the disparities in healthcare, and on the other hand, not participate in the clinical trials that will give us the scientific information that we need to be able to close those disparities. You can't have it both ways. We can't be concerned with the premature ending of Black life. We cannot be upset and outraged at the misery and suffering that we as a people experience in much greater levels than any other population in this country. You cannot be simultaneously angry at that and then deny yourself the science tools and the information necessary to close those gaps. We have to start getting past this distrust and moving forward. So I'm sorry, but this is the best audience in the country to be able to make this point. We need our entrepreneurs, we need our problem solvers, we need our thinkers to come together and help us turn the culture from one of just mad to one that's mad, and now I'm going to do something about it so I don't have to stay mad.
I could not agree.
Well said. Well said, Dr. Tucson.
Absolutely. This is also about the workforce and us being a part of that workforce, going into the medical profession, going into the business of healthcare and public health, and leading those organizations, being in positions of power to influence and make decisions that are going to collectively change the inside of healthcare organizations, but also force these organizations to invest in the community, to think about housing, to think about education, to think about food. We need leaders in this space. In hospital and health system administration, we are woefully underrepresented at probably about 11% when you look at the top leadership positions in the country. And that just won't do. Our lives actually depend on our ability to be involved and lead in these organizations and in these discussions.
Duane, I'm so glad you made that point, because I was just about to ask you for, a more macro perspective on the consequences of these disparities. You have a statistic on your website that is just mind-blowing, which is that the economic burden of racial health inequalities in the US is $230 billion. Can you please explain that?
Yes, so there was a study done, and that was over a 4-year time period, but there was a study done that included data from many sources studying the impact of disparities and the cost of disparities in the system. And as we know, the healthcare system itself is a huge part of our gross domestic product and the spend that we have in this country. It is crippling our communities with debt. And so when we think about how healthcare is financed and paid, we know that today the environment is predominantly set up in a fee-for-service way. What that means is that as you come in as a patient, the more patients that a hospital or health system or physician practice sees, the more dollars they get. We're slowly shifting to a system that is based off of value, meaning if you go into an organization, they are going to at some point be at risk of making sure that you have a good experience and making sure that the quality outcomes are equal and appropriate, and making sure that cost is taken into consideration. We as a people, because of the chronic conditions, because of the things that we've talked about related to social determinants of health, often are the ones who are unfortunately burdened with many of the costs in the system. And we're the ones who are readmitting to the hospitals, showing up to emergency departments, and having these adverse outcomes that actually drive costs in the system. And so if, again, we can be participatory in the process and push these organizations to do things such as collect race, ethnicity, and language data, sexual orientation and gender identity data, and then do performance improvement around that, we will begin to close some of the healthcare disparities that are created inside of these hospitals and health systems.
I know that both you and Dr. Tuckson have done this work from the inside. You both have worked in the past for healthcare systems. What did you see firsthand that informs the work that you do now?
I think the firsthand that you sort of ultimately experience is the range of choices and the consequences of choices that each of us as individuals make. When you really think about it, look in the mirror. And when you look in the mirror, you're seeing the best doctor you will ever meet, because there is no one who will make more healthcare choices than that person in the mirror. There's no one who will make more decisions that will have health outcomes and consequences than that person in the mirror. And finally, there's no one who needs to take control over their own health other than that person in the mirror. And so what we have to first do is to decide that my life matters, and I will make choices and decisions. And then I will look for partners who can help me. I will look for outlets where I can get information. I will look to the healthcare system as a collaborator of mine, not an owner of mine, not the boss of me, but a partner of me. And I think that if you start to look at your life and say, I'm going to now control my life. I'm going to be attentive to what I eat. I'm going to be attentive to whether I exercise and how long I do. If I need information, I will find a partner to help me, and then I will incorporate that information. But at the end of the day, Black lives matter. And when it starts, it has to start with my life matters, and then find the partners. When I was on the inside, you found it to be very difficult often to be able to make those bonds, those connections, because it's almost as if many times the health system is pushing the individual to be healthy. That's backward. The individual needs to decide to be healthy and then let everybody else work for you. Everyone else works for you.
Absolutely. And I think, what I've seen inside of provider organizations, what I've seen across the industry when I served as the president for the Institute for Diversity and Health Equity at the American Hospital Association, is the reality that hospitals have not really tackled any form of institutional racism. Not till after this pandemic and after social unrest did they really start to pay attention to these things. And there are still hospitals that, until they're forced to pay attention to these things, will not. And it is about education and training of their staff and unconscious bias. It is about understanding that their policies and their processes may cause disparate impact. It is about leadership. allowing leaders who have lived experience and have trust built within the community to actually lead and to be a part of the conversation in a very real way that helps to change the institution.
So when we start to talk about these solutions, what we're going to do about it from here, Duane, this is what your company does every day: consult, advise, and train healthcare companies, leaders, and employees. What are you trying to advise them to do?
Thank you. Great question. We are really looking to move towards a more just and equitable healthcare system. That is our end goal. But the way that we do that is helping organizations to understand, one, what health equity is, and two, what the connection is with creating a space of belonging, meaning we're paying attention to diversity, equity, and inclusion. Those two things, the internal culture and how we attend to our community and our patients from a health equity lens, become really important to actually changing the inside of these organizations, and then changing the outside with connections with corporate organizations, with community-based organizations, with churches, with the people who are part of the community. So what we do is advise leaders, one, helping those leaders who may not be a part of the African-American population to understand why this is critically important, not from just a moral perspective, but from a business perspective. Then we go into organizations and we do assessments, and we come up with where the gaps are, the things that they need to be working on, and help them to create a roadmap for change over 1 to 3 year period, because this really is about cultural transformation. So we lead them in those efforts.
Shana, your organization is more focused on public education and also advocacy on a policy level. You mentioned before about the importance of health literacy. Share with us what you're doing to educate the public.
So before I answer that question, I do want to just connect to the previous question and say that we as a community have an opportunity, particularly our healthcare systems and our healthcare partners have an opportunity to create environments and drive cultures that very much support agency over individuals. So making sure that we're having the conversations to encourage patients who come into their offices to ask questions, and encouraging them and empowering them to take that agency over their well-being. And that is very much what our policy efforts and our health literacy efforts focus on. We want to make sure that women know their health, their welfare, their wellness is theirs to drive, and to offer the tools, the information, and the support to allow them to feel empowered to do that. From a public policy perspective, we as an organization very much focus on leveraging, generating evidence that strongly supports prioritizing Black women and girls on just a number of policy and community level issues, including access to affordable contraceptions. We've talked about the Affordable Care Act. And as we know, the Affordable Care Act, as well as access to quality healthcare insurance, allows for us to make those decisions and to feel like we have the agency over our healthcare.
Dr. Tuckson, your organization similarly is focused on public education and policy advocacy. Can you share with us what Blacks Against COVID-19 is doing?
Well, one of the things that we really are focused on, and it's the principle that I learned many, many years ago, health is the place where all of the social forces converge to express themselves with the greatest clarity and the most importance. Health is where every road in our society ultimately leads, and it determines whether or not we live or whether we die. And so I cannot emphasize enough the importance of community, the ability to work with our faith leaders, to work with our organized labor leaders, to work with our musicians, our poets, our actors, our artists, our musicians, to be able to work across every sector that defines what it means to live in a community of people. And then being able to engage those, to harness the power. No matter how poor or challenged any of our communities are, they are still filled with assets. Those are assets that need to be repurposed for the fight for life, for the fight for survival. We have been in this country a long time under enormous odds, trying just to survive. Survival has always been what it is about. And now we're trying to not only survive, but have a better quality of life. This is a team sport. And so I come back again. Where we are today, we are in an era of healthcare that is very focused on consumerism in healthcare in a way that it has never been before, where individuals will have the power and the responsibility and the opportunity to determine how their health is structured, how they get care, and the outcomes of that care. So I would remind this audience once more of entrepreneurs, of business people, of people who are trying to solve problems. Please, we need every one of your skill sets. If you are a great communicator, help us to develop the messages that people can hear, that they can understand, in language that they can hear. It's part of the normal culture. Health should not be this thing off to the side as some ghettoized thing off to the corner. It's a part of the fabric of our life. So if you're good at communicating, we need you. If you're good at the internet, we need you. Whatever your skill set is, deputize yourself for whether or not your grandma lives, whether your grandchildren have a chance to be healthy, and then also be worried about the neighbor down the street.
Well, that is a great transition to my next question, because for everyone listening out there, I would like you each to speak directly to them about what we can all do as individuals, either as citizens and voters to address this issue, or as patients and consumers in the healthcare system to best advocate for ourselves and our families. So Duane.
Sure. I will start by echoing Dr. Tucson. This is a team sport, and we absolutely have to be involved in the game. At an individual level, we need to understand bills and legislation and local policy that is happening, and we have got to get out and vote. We have to do what we did down here in Atlanta and mobilize our community in order to be able to put in leaders who understand and are focused on racial equity and changing the tide for our communities. As a patient, you have to understand that your care, your health is ultimately your responsibility, but you have a voice. Just because a doctor has many, many years of education, and no challenge to you, Dr. Tucson, but patients, we must understand as patients that ultimately we know ourselves, we know our bodies, and we must advocate. When we have those moments of feeling like we have not been heard, find the appropriate people in the organization to express your discontent to. When you are not satisfied with something that you've heard from a clinical perspective, go get a second opinion. These are things that we can do to help really take care of our own health.
What do you want everyone out there to do, as citizens or as consumers to address this?
Was that to me? I think that the thing that I would really want people to do is, and it might, because Duane has given such good things, so let me just sort of indicate, go out and be the best advocate for learning science and mathematics. We cannot be functioning as a people in a science-driven world, a world where healthcare is going to be fundamentally based on genetics, on very complex principles. We talk about this COVID vaccine, an mRNA virus. Well, wait a minute. How many of our people understand what mRNA is? But this is the modern world. So if you can do something out there, I would urge you, be down in front of that school board and make sure you've got science teachers teaching our kids science and math, and be able to create learning laboratories and tutoring sessions for kids so they will be facile with the modern technology. If we don't do that, not only will we not be healthy, but we're going to be left behind in this modern world. The race is on.
And Shana?
My recommendation to support the others is, we are a people who have a history of taking control of our narrative, and this is no different. The All of Us research program is a place to start, a place to begin your path, your journey to understanding your DNA, to understanding how it impacts the way your healthcare partners care for you, how it impacts the decisions that your children and your generations will be able to make on the information that you provide today for them tomorrow. And then lastly, knowing that you have agency over your information in this process, and that you can share as little or as much information as you would like, but ultimately this process, this relationship through this program is ultimately controlled by you as the individual.
Well, I want to thank all three of you for all of the information that you have shared with us today, but especially for the work that you do every single day to try to close this gap for our community. Thank you so much.
Thank you.
Thank you.